If you're over 50 and every step you take reminds you that your knees aren't what they used to be, if standing up from a chair feels harder than it should, if stairs have quietly become your enemy, then stop right now because this video could change the way your knees feel starting today. And I'm not exaggerating. Most people think knee pain after 50 is just normal aging. That it's something you have to accept, tolerate, or cover up with painkillers, knee braces, or injections. But here's the truth nobody tells you clearly enough. Most knee pain is not because your knees are weak beyond repair. It's because the muscles around your knees have stopped doing their job. And the good news? You can wake those muscles back up with just 2 simple exercises. Not complicated, not painful, not gym-based. And yes, you can start today, even if your knees already hurt. Now listen closely because I want to save you from a huge mistake. Many people with knee pain jump straight into squats, lunges, jogging, or machines at the gym. And what happens? The pain gets worse. They assume exercise is the problem, so they stop moving altogether. That's when stiffness increases, balance gets worse, and the knees decline even faster. What we're going to do today is completely different. We're going to strengthen your knees safely by targeting the exact muscles that protect the knee joint, reduce pressure inside it, and help it feel more stable and pain-free when you walk, stand, and climb stairs. Before I show you the exercises, let me explain something in simple terms. Your knee is like a hinge. It depends heavily on the muscles above and below it for support. When your thigh muscles, especially the quads, get weak, your knee absorbs more shock than it should. When the muscles behind your thigh and around your hips stop activating properly, your knee starts twisting and shifting in ways it was never designed to handle. Over time, that creates pain, swelling, stiffness, and that awful grinding or clicking sensation. Strengthening these muscles doesn't just make you stronger. It literally unloads your knee joint. That's why the right exercises can reduce pain instead of increasing it. So let's talk about the first exercise, and I want you to really picture this as I explain it. This is one of the most knee-friendly movements you can do, and it's often used in physical therapy for people with knee arthritis, meniscus issues, and general age-related knee pain. You can do this at home, on a chair, and you don't need any equipment. Sit tall on a sturdy chair with both feet flat on the floor. Your back is straight but relaxed. Now slowly straighten one leg out in front of you until it's parallel to the floor, or as close as you can comfortably get. You're not forcing it. You're lifting with control. Once your leg is straight, gently tighten the muscle on the top of your thigh. You should feel your quad working, not sharp pain in your knee. Hold that position for just a couple of seconds, breathing normally, then slowly lower your foot back to the floor. That's 1 repetition. What makes this exercise so powerful is how controlled it is. There's no impact, no sudden bending, no pressure through the joint, yet it directly strengthens the quad muscle that acts like a shock absorber for your knee. If you feel a mild pulling or effort in the thigh, that's perfect. If you feel sharp pain in the knee itself, reduce the height of the lift or slow the movement down. The goal here is quality, not force. Over time, as this muscle gets stronger, you'll notice standing up from chairs feels easier and your knees feel more supported during walking. Now let me give you an important tip that makes this exercise twice as effective. As you straighten your leg, imagine you're gently pushing your knee forward and lengthening the leg, not locking it aggressively. Keep your toes relaxed and pointed slightly upward. This keeps the movement clean and prevents unnecessary strain. Start with just a few repetitions on each leg. Even 5 slow, controlled reps per side is enough in the beginning. You don't need to rush this. Consistency beats intensity every single time, especially after 50. Now let's move on to the second exercise, and this one is a game changer for knee stability. Many people are shocked to learn that knee pain often comes from weak muscles above the knee, particularly around the hips and thighs. When those muscles don't fire properly, the knee takes the stress. This exercise trains those muscles without bending the knee deeply, which is why it's so safe and effective. You're going to lie on your side, either on the floor or on a firm bed or mat. Bend your bottom leg slightly for balance. Keep your top leg straight, in line with your body, not drifting forward or backward. Now slowly lift your top leg upward just a short distance. You don't need to lift it high. What matters is that your leg stays straight and your toes point forward, not upward toward the ceiling. As you lift, you should feel the muscle on the side of your hip and thigh working. That muscle plays a huge role in keeping your knee aligned when you walk. Pause briefly at the top, then slowly lower your leg back down with control. This movement might look simple, but don't underestimate it. If you've had knee pain for a while, you may notice this muscle feels weak or even shaky. That's normal. You're waking it back up. The key is slow, controlled motion. No swinging. No jerking. Just smooth lifting and lowering. Start with a few repetitions on each side. If you can do 8 to 10 with good form, that's excellent. If you can only do 3 or 4 at first, that's perfectly fine too. Now here's something very important, so listen carefully. These exercises should never make your knee pain worse during or after. You may feel muscle fatigue, mild soreness in the thighs or hips, or a sense of effort. That's good. But sharp pain, swelling, or lingering discomfort means you need to reduce the range of motion or the number of reps. Pain is not a badge of honor, especially when it comes to joints. We're strengthening to protect, not to punish. Let me also talk about how often you should do these exercises, because this is where people either get great results or give up too soon. You don't need to do these for an hour. You don't need to sweat. You don't need to push to exhaustion. Doing these exercises once a day, or even every other day, is enough to start seeing improvement. The muscles around your knees respond very well to gentle, consistent activation. Many people notice less stiffness within a week or two, and more confidence in their knees within a month. Now, I want to address a fear that many of you might have but haven't said out loud. You might be thinking, my knees already hurt. Won't exercising make it worse? That's a completely understandable concern. The difference here is that we're not loading the knee joint aggressively. We're strengthening the muscles that support it. Think of it like reinforcing the beams around a door hinge so the hinge doesn't take all the stress. That's exactly what these exercises do for your knees. Another question I hear all the time is, what if I have arthritis? And the answer might surprise you. Gentle strengthening is actually one of the best things you can do for arthritic knees. Stronger muscles reduce joint pressure, improve circulation, and help keep the knee moving smoothly. Of course, you should always listen to your body and work within your comfort level, but avoiding movement altogether usually makes arthritis worse, not better. As you continue doing these exercises, pay attention to small wins. Maybe you notice you can stand up without using your hands as much. Maybe your knees don't ache as badly in the morning. Maybe stairs feel a little less intimidating. These changes matter. They mean your body is responding. Don't wait for some dramatic overnight transformation. Real improvement is quiet and gradual, and that's exactly how it lasts. I also want to remind you that knee health isn't just about exercise. Simple habits make a big difference. Move your knees gently throughout the day. Avoid sitting for hours without standing up. Walk at a comfortable pace. Stay hydrated. And most importantly, stop telling yourself that pain is inevitable just because you're over 50. That belief alone keeps so many people stuck. Let me speak directly to you for a moment. If knee pain has been limiting your life, if you've stopped doing things you enjoy, if you're worried about losing independence in the future, know this, your body is not broken. It just needs the right signals. These 2 exercises send those signals clearly and safely. They remind your muscles how to protect your knees the way they were designed to. So here's what I want you to do. Try these exercises today. Take it slow. Be patient with yourself. And commit to doing them consistently for the next few weeks. Not perfectly. Just consistently. Your knees don't need perfection. They need movement, support, and time. If this video helped you understand your knee pain in a new way, make sure you support the channel by liking the video and subscribing for more simple, practical exercises designed specifically for people over 50. Share this with someone you know who complains about knee pain, because chances are, they've been told to just live with it, and they deserve better than that. Remember, strong knees aren't about doing more. They're about doing the right things the right way. Start today, stay consistent, and give your knees the chance to feel stable, confident, and pain-free again.